All right, so I'm checking the patient's MAR to see if he has an order for an indwelling catheter from the physician, and I see that he does. Perfect. So I'm gonna gather all my supplies, make sure this table is all clean, put my supplies down on the top of the table. Right, I'm gonna perform hand hygiene. The trash can is right next to me. All right, so here we go. Hi, Mrs. Johnson. My name's Laney. I'll be your nurse today. How are you doing this lovely morning?
I'm doing okay.
Good. Can I have you state your name and date of birth for me?
Mrs. Johnson, 062593.
Okay, I'm checking the tag, and I'm also checking the MAR, and if everything matches. I also see she doesn't have an allergy bracelet. The MAR doesn't say, but I'm going to ask the patient just in case. Mrs. Johnson, do you have any allergies to latex or iodine?
No, I don't.
Perfect. All right, so what I'll be doing is I'll be inserting an indwelling catheter. Is that okay?
Sure.
Perfect. All right, so I make sure I have adequate lighting, which I do. I'm going to provide privacy, make sure the door is shut. All right, I'm gonna. Mrs. Johnson, is it okay if I pull up the blanket in your gown?
Yep.
You will be exposed, but just so you know, I did provide, the curtain is closed and the door is shut, so you do have privacy.
Okay.
All right, I will grab gloves. And these are my non-sterile gloves, so I'm just using these to move her legs and provide pericare before I get started. So, legs, make sure they're spread apart at a comfortable position in there. Make sure her legs are elevated. How's this position for you? Feeling any pain or
Nope.
make you uncomfortable?
It's okay.
Okay, good. All right, so first I'm going to perform pericare on you just to get that area cleaned up, okay?
Okay.
So with a warm washcloth, I'm gonna wash her vagina starting from top to bottom, using different sides of the washcloth, different corners. Don't want to, don't want to risk infection. Top to bottom. I want to do it 3 times. Okay, I'm gonna just throw it aside. Now I'm going to dry it. Okay. I'm now going to remove my gloves. Perform hand hygiene again. Now I'll get started on my sterile field. Alright, so my shiny side is down. It is non-sterile. So I am going to open it away from me. When I go under, I'm touching the non-sterile side with no gloves on. I'm not breaking it, but I still want to make sure I open it away from me. 1 inch is non-sterile field. All right, so I'm going to take out my gloves. And if I want to, I can move it. I grab the bottom, move it a little bit, just so I have room to put my gloves on. All right, so with my non-dominant hand, I'm going to grab the outside of the cuff, and I'm going to insert dominant hand into the glove. Also I'm still touching the outside of the cuff. Having difficulty, but I can fix it. Alright, so I will be fixing it. So I'm going to insert my finger here's under this cuff, under this cuff, and I'm going to insert my other hand. Hand is still under the cuff. Okay, so now sterile to sterile, I can fix this glove now. I am sterile. I'm going to throw this away above my waist. I'm going to take the sheet that's going to go under the patient, unfold it. Shiny side will go on bed. It's not sterile. I'm going to ask the patient if she would lift her bottom for me. And she has, so I will insert it under her bottom without touching the patient with my sterile gloves. And I will unload everything else. So I'm getting my swab sticks open, and there's 3 of them. I will be using 3. Extra just in case. I had some lube. I squeeze it on there. Alright. First thing I'm going to do is I'm going to clean her peri area with the iodine 3 times in the fold. So what I'm going to do, actually before I do that, I'm going to insert, I'm going to get the catheter ready. I'm going to lube the tip of the catheter 2 to 3 inches. Okay. I'm going to insert the syringe into the catheter at 10 milliliters. Perfect. Now I'm going to swab with iodine. So with my non-dominant hand, which will become sterile once I touch, non-sterile, which I touch when I touch her. So I'm going to spread the folds, and from top to bottom, one at a time. Throw it away above my waist. My right hand is still sterile. One more time. All right, now I'm going to get the catheter situated. All right, so I'm going to hold it in my dominant hand. I'm keeping it spread. Insert it. I'm going to tell the patient to bear down and take a deep breath for me as I insert it. 2 to 3 inches in there. And if I'm feeling resistance, then I just twist it. At the same time, I'm also, if I notice any pain, I'll ask the patient to see if I need to stop for a second. I don't want to hit the bladder. So now with my non-sterile hand, I'm going to hold the catheter in place because I don't want it to fall out. My right hand is still sterile, so what I'm going to do, I'm going to pump the balloon, 10 milliliters. is in there. So now what I'm going to do, I'm going to place the bag below. I will place the bag below the bladder, of course, and hook it onto some place of the bed. Alright, so I'm going to remove my gloves. Perform hand hygiene. I'm going to grab another pair of gloves so I can strap on the catheter to her leg. And these are non-sterile gloves. Also, at the same time, I'm going to give her a little, make sure there's enough room for her to move around. So I'm not going to place the catheter too tight on her leg. Right here, and if I need to take a urine sample, I could wait until there's urine in the Foley bag, or I could take it from here, which would be a better result for the lab. Alright, so I'm going to get rid of this. I'm going to remove this. Alright, I'm going to push this out of the way. Gloves again. Perform hand hygiene. All right, Mrs. Johnson. So your catheter is in. Did you feel any pain when I was doing that?
No.
Great. So what's going to happen is your Foley bag, your bladder is going to drain into the Foley bag, and in a little while I'll come back to check on it and measure it. So I'm going to pull down your back. I'm going to pull your gown back down, as well as your blanket. Is there anything else I can do for you, Mrs. Johnson?
Nope, I don't think so.
Perfect. All right, so I'm going to document everything I did. I'm going to document her response, the procedure, sterile equipment, everything. All right, and I'm going to perform hand hygiene.